Hey folks, Dr. Ed here with Total Body Healthcare giving you your healthy video thought of the week. Normally I try to keep my recommendations pretty simple on how to improve your health. Get a little bit more complicated today in that I want to drop some biochemistry knowledge on you and show you how the process or how we get so much inflammation in our body. I see it all the time in my patients every single day. They have systemic inflammation, and that's where a lot of their health problems are coming from. And it's not just in their joints. I see it in their cardiac system. I see it in their circulatory system. I see it in their digestive system, in their respiratory system. I see it in lots of different systems, and the question comes, how is there so much inflammation in the body? Quite honest with you, it starts with what we eat, what we put on our bodies. If inflammation comes from a chemical, we put chemicals into our body through what we eat. So here's how the process works. When you're cooking, when you read labels, if you see or use any of the vegetable oils, corn, cottonseed, sunflower, safflower, peanut, soy, or canola oil, any of those oils are going to contain an omega fatty acid called linoleic acid. In particular, it's an omega-6 fatty acid. In your body, that linoleic acid converts over to dihomogammalinolenic acid, or DHGLA as it's known. It is also an omega-6 fatty acid. Now, DHGLA and linoleic acid, for that matter, both have some pretty important functions in our body, but what happens is when trauma is introduced into our system, and that trauma can be a physical trauma, it can be chemical trauma, honestly, it can be emotional trauma as well. When that trauma is introduced into our system, our body kicks out an enzyme called delta-5 desaturase, or D5D. D5D then takes our DHGLA and converts it very quickly, actually, down to arachidonic acid. This is where the problem comes in, because arachidonic acid then falls through the COX enzymes, we'll go over that in a little bit, into a chemical called prostaglandin E2. Now, prostaglandin E2 in normal volumes has some benefit to our body. We need it. In other words, God would not have put it there if we didn't need it. It's when we get too much prostaglandin E2 that the problem comes in, because prostaglandin E2 is what causes inflammation. And as you can see here, inflammation is responsible for the fibrosis that's in our joints. In other words, we call it arthritis, pain, degenerative joint disease. Inflammation is also responsible for vascular disease. Anybody that's dealing with cholesterol or clotting of the arteries can attribute that to inflammation, which goes all the way back up to this omega-6. Inflammation is also responsible for immune system dysfunction. In other words, prostaglandin E2 increases the immunoglobulin E, IgE is what it's called. IgE is what's responsible for allergies, and it decreases the production of IgG, the immunoglobulin G, which is responsible for us fighting viruses and bacteria. So immune system dysfunction means increased allergies, decreased ability to fight off viruses and infection. And prostaglandin E2 is the number 2 cause of free radicals in our body, and free radicals are what causes cancer. So if we can avoid this linoleic acid up here by avoiding so many vegetable oils in what we eat, this process is not going to go through. The other thing that we can do, because we still need a little bit of linoleic acid in our diet, and we're going to get it through some of these foods if we eat them in their natural state. But what we want to do is stop the process right here, because from this DHGLA, if we can get it to turn the corner and go the right way without any trauma, it's going to produce prostaglandin E1, which is a great healthy chemical that we need in our body, because it does so many different things that are great for us. So if we can limit this, it's not going to produce as much of this. And then if we can stop this chemical reaction by introducing another omega fatty acid, in particular, this is an omega-3 fatty acid, and we get this from fish oil. So if we decrease the amount of linoleic acid, the omega-6 that we're taking from not eating so much vegetable oils, and then increase our intake of omega-3 fatty acids here, the fish oil, the EPA, that's going to stop the chain reaction to keep from getting down here to the inflammation because of the prostaglandin E2. So, your takeaway: decrease vegetable oil, increase fish oil, and you're going to be doing better. If you have any questions or comments, type them in underneath this video. Hit the like button if it helped you. Send it off to a friend. Hit the share button for us. Always feel free to contact us at totalbodyhealthcare.com. We look forward to seeing you on our next video next week.